So in dentistry today, they're really pushing the whole conservative nature of prepping teeth. The problem is when you first start dental school, the first 2 years when you're working on, ivorine teeth and a fake head, you're working on these prep teeth that are what we call ideal GV black preps. They're nice and open, they're nice and clean. As soon as you get into clinic, they start trying to teach this ultra conservativeness where the dental students are just basically scratching the teeth with a burr and they're not removing decay.
People want to leave decay and not take away as much tooth structure, where in the long run not doing that causes a bad restoration, and then you have to come back a year from now because the filling fell out because you've got a new cavity there, or the crown has decay underneath it, needs to be replaced.
Or even worse, you've masked it to a point where you don't notice it until the patient's in pain. And then that patient needs a root canal, an extraction, things where if you are just maybe a little more aggressive, now you don't have to blow up the tooth, but to go in there and actually remove the decay to make sure there's not that bacteria in the tooth so that you get a good solid restoration that lasts. That's something that I try to teach the dental students when I'm working with them.
New practitioners, especially dental students, everybody's scared to take away too much tooth. But the truth is to get the restorations to look good, and if you talk to people who have been out for years and who do these kinds of restorations all the time, you need to be a little more aggressive to get it. To get a solid result.
Especially when it comes to pediatric teeth, because they're so much thinner. That enamel layer in a pediatric tooth is much thinner than an adult tooth. So your margin of error for missing a diagnosis is much smaller. If you miss a class 2 lesion on a primary tooth, 6 months later, instead of needing a filling, that tooth is going to need a crown. And a year later, most likely that tooth will have to come out. So the longer you hold off on properly diagnosing it or properly restoring it, the greater the treatment then you will need. So while it may seem a little aggressive at first, in the long run you're doing less work. It's easier for the patient because there's no difference in discomfort as long as the child's properly numb. To do a ultra conservative where you just scratch a tooth versus doing a more traditional prep, the child doesn't feel anything else, but the likelihood of that child coming back in 6 months to a year to get the same tooth treated on is decreased. So there's a time and a place to do conservative, and then there's a time and a place to make sure you just do good quality dentistry where you're removing the decay of the tooth.
The case we did today with the 4 anterior crowns, the decay was severe right down to the, right down subgingival. And many people would look at those teeth, and without having these kind of restorations, the crowns, the alternative would be to extract those teeth. And there's still a lot of practitioners that will extract those teeth just because they don't know how to do the crowns. I mean, you saw the preps take 30 seconds a tooth. It's not a hard prep to do, but you just have to be aggressive, go subgingival. You can't be scared of prepping around the tooth, going close to the gum line. The gums are gonna bleed when you're trying to prep around a tooth subgingival. It's just gonna happen. And it's part of the preparation there. At the end result, the crowns get cemented, the gums stop bleeding in a half hour, and you have a beautiful looking tooth, where the alternative would be to have taken that tooth out.